The optic nerve injury included non-traumatic optic nerve injury and traumatic optic nerve injury. Non-traumatic diseases include glaucoma, diabetic retinopathy caused by hypertension, optic neuroblastoma, and thyroid-induced retinopathy, and these are common in clinical practice. Glaucoma is characterized by the progressive death of retinal ganglion cells and axonal loss. Even more serious is the central gaze. Glaucoma is divided into primary glaucoma and secondary glaucoma. Primary glaucoma refers to the increase in intraocular pressure and the degeneration of the optic nerve under physiological conditions. Secondary glaucoma is caused by inflammation, trauma, ocular vascular damage, or increased intraocular pressure due to neovascularization, among other causes. With the rapid development of medical diagnostics, the early screening of glaucoma relies on the measurement of retinal nerve fiber layer thickness by optical tomography, OCT, combined with intraocular pressure detection. Numerous studies have shown that the use of optical tomography scanners to detect the thickness of the retinal fiber layer can only be effective when the onset of glaucoma reaches a certain point, such that the retinal nerve fiber layer has been damaged. Diabetic retinopathy is a retinal vascular complication. Retinal blood vessels are important transport tissues that provide nutrients and energy support for cells in the retina and the optic nerve. Diseased retinal blood vessels may affect all cells in the retina, thereby resulting in irreversible damage to the optic nerve. Due to the complex pathogenesis of diabetic retinopathy, systemic therapy is the mainstay of treatment and includes the control of blood sugar, blood lipids, and blood pressure, as well as regular fundus examinations. Retinal laser therapy and intraocular anti-VEGF drugs, among other treatments, are used to inhibit neovascularization in the retina. When the intravitreal hemorrhage is excessive, such that it cannot be absorbed, vitrectomy is then required. As a result of ischemic optic nerve injury, retinal microvascular occlusion puts the optic nerve in a state of ischemia and hypoxia for a long time, and the optic nerves atrophy. Ischemic optic nerve injury is divided into optic nerve head injury and posterior optic nerve injury in accordance with the site of injury. Acute optic nerve injury is more common in middle-aged and elderly people over the age of 50. The site of optic nerve injury is generally within the anterior part of the optic nerve. In these instances, the visual acuity of the unilateral eye typically decreases significantly without pain. There are some cases of bilateral acute optic nerve anterior injury in clinical practice. Posterior optic nerve injury is often caused by ischemia and hypoxia, caused by the occlusion of the short posterior ciliary artery, and local optic nerve edema further aggravates the injury.